So good afternoon, everybody, respected chairpersons and dear friends. Now I am going to speak on tips for topical SICS. As Professor Titial has already said, there are different types of cataract surgery with excellent result. SICS is one of them. So SICS is also now proved. So proved to be equivalent to phaco surgery. Now, one of the disadvantages or one of the problem with SICS is to do topical surgery. So, as topical has become the topic of the day, people started demanding no injection cataract surgery. So, SICS surgeons should not think that they are not able to do topical surgery. So, I am going to speak few tips about the topical SICS. So, this is particularly for those SICS surgeons who are very comfortably doing surgeries and thinking of converting to SICS topical, but not able to do. So, when to start? In case of block failure, if you remain calm and complete the surgery, then you have perhaps reached the right stage to move on to topical surgery or topical SICS. So, you should not shout at the patient, your attendant, the person who has given the block. So, slides not moving. Hello. Slides not moving. So, while doing SICS, you have to think of avoiding certain things. Superior rectus suture is one of them because in topical, you have to make the patient very comfortable. So, start avoiding superior rectus suture, avoid doing cautery, avoid dialing the IOL, and you have to reduce your surgical time because if the patient will feel uncomfortable, he will not cooperate with you. And you have to avoid your mental block. That topical cannot be done. This video. Mouse nahi hai idhar. हाँ आगे. So many times people cooperate as if they have been blocked. So you can start doing without any superior rectus suture. Then you will have a little bit of bleeding because you are not doing any cautery. That also helps in healing of the sclerocorneal wound. Phaco sandwich technique I used to do SICS. Then I will also can be put without dialing inside. And you can safely complete the surgery. So initially you have to avoid uncooperative patients, very old, hard of hearing, who will not be able to obey your commands. Immature cataracts, because they take little longer time. Deep set eyes also, small rigid pupil. Phenocane also helps in these cases. So these are the cases you have to avoid initially. Then otherwise topical SICS is possible, and it is also a better option for the patients and for the surgeons also. Thank you very much. Thank you for present here.
Thank you for a nice presentation, Dr. SABYASACHI. I request panelists, any comments on this? Dr. Rajshekhar.
Yeah, topical and block, the main difference is the comfort of the surgeon. The surgeon has to be extremely good in his skills, because now another parameter of patient's pain sensitivity, the duration for which he can cooperate without anesthesia, and then again the eye moving and associated intraocular pressure situations during the surgery will come up. So if the surgeon is very comfortable, then they should move on to topical. So that's one very important factor. And during the surgery, if there are situations where things are going out of hand, one's ego shouldn't come in the way of giving a retrobulbar anesthesia or on the table, whatever anesthesia that's required to do it. Compared to phacoemulsification, SICS topical is little more challenging, but in skilled hands, it's still possible. And Dr. Titial, please.
Thank you, thank you. Dr. Amaya?
Yeah. Sir, are you giving any subtenance block?
No, only intracameral.
Yeah, I think as Dr. Rajshekhar pointed out, it is the comfort of a surgeon also.
Yes, yes.
And the patient's acceptance of a little bit of a strain which may be there. I would not mind giving a little bit of a subconjunctival in a incision area, because that is just area of concern, and then you can do a entire surgery with intracameral also. And SICS is the main surgery for India, Almost 60-70% of surgeries SICS in the country, and people have to learn this surgical technique so that we can give a large number of surgeries, which is the mandate of a country now, to the every corner of this thing. You want to say something?
I think the main goal should be a good visual outcome first. So whether or not block is a different issue. And yes, definitely to move ahead with topical is a good step. But safety first, and definitely the goal should be that the visual outcome should not be compromised at any point. If you feel that the patient's cooperation or the patient has started wincing and not cooperating, then without compromising on that, we can only go ahead.
Now the patients have started demanding also no injection surgery. So in that case, the comfort level and the competence of the surgeon actually is the most important factor.
Yeah, so a good microscope with good visibility and good red glow will
Everything
help
has to
faster
be-
surgery. Definitely.
Thank you.
Thank you.
Wonderful
Very
skill,
nice
sir.
talk.
Thank you.